I get asked all the time, Dr. Silverman, why did you start your own practice? Why don't you just work for one of those big dental chains? And the answer is simple, because I couldn't practice the way I believe dentistry should be practiced. I'm Dr. Jonathan Silverman from the Maryland Center for Complete Dentistry here in Owings Mills. And today, I want to talk to you about something a lot of dentists won't say out loud. The difference between corporate dentistry and a practice where the dentist actually owns the business and cares about the outcome. Because that difference, it affects your care more than you might realize. Let me be clear, I'm not saying every corporate dentist is bad. There are good dentists working in corporate settings, but the system itself, the ways those businesses are structured, it creates problems. Here's how corporate dentistry typically works. The dentist is an employee. They don't own the practice. They get paid based on production, how much dentistry they do. The more procedures, the more they make. The office is managed by people whose job is to maximize revenue, not health outcomes, revenue. And the dentist, they're often seeing 30, 40, sometimes 50 patients a day. They're moving fast. They're under pressure to produce. They're not the ones you talk to when there's a problem. You talk to customer service. Now contrast that with a practice like ours. I own this practice. My name is on the door. My father was on it before me. When you have a problem, you talk to me, not a call center, not a regional manager, me. I don't get paid more for doing more procedures. I get paid when you're healthy and you refer your friends and family because you trust the care you've received. And I can take my time. If a crown needs an extra 10 minutes to get the fit perfect, I can do that. If a patient needs more explanation about their treatment options, I can sit there and explain it until they understand it. In corporate dentistry, that dentist is already behind schedule. They've got 3 more patients waiting. They don't have 10 extra minutes. Here's what this means for you as a patient. In a corporate setting, you might hear, you need this crown, you need that root canal, you need these fillings. And it all might be true. But is it urgent? Are there other options? Can you phase the treatment? Can you do preventive care instead? Those conversations don't happen when the system is built around maximizing production. In our practice, I'm going to tell you what you need, what can wait, and what you can do to prevent with better home care. Because my goal isn't do as much dentistry as possible. My goal is to keep you as healthy as possible with the least amount of intervention. Let me give you an example. A patient came to me from a corporate dental office. They'd been told they needed 6 crowns. 6. They were looking at $8,000 to $10,000 in dental work. I examined them. You know what they actually needed? 2 crowns. The rest, those were old fillings that were fine. They had some staining, but structurally, perfectly sound. Now, did the corporate dentist lie? Maybe they legitimately thought those teeth needed crowns. Or maybe they were under pressure to hit their production numbers and they were over-treating. I can't say for sure. I don't know. But I do know this. That patient saved $6,000 because I don't have a production quota to meet. Here's another difference. Continuity of care. In corporate dentistry, you might see a different dentist every time. The dentist who diagnosed you isn't the one doing your treatment. The dentist doing your treatment might leave next month and someone else takes over. In our practice, I'm doing your exam. I'm doing your treatment. I'll be there next year when you come back for your checkup. I'm invested in your long-term health because I'm going to be the one dealing with the results, good or bad. And here's something most people don't think about: quality. When a corporate practice is pushing volume, seeing 40 patients a day, what gets sacrificed? Time, attention to detail, proper isolation when placing a filling, making sure a crown fits perfectly before bonding it in, taking the extra steps to ensure the bonding is completely dry. All those little things that make the difference between dental work that lasts 7 years and dental work that lasts 25 years. Those get skipped when you're racing through patients. I talked in another video about how I have crowns in patients' mouths that I did 25 years ago. You know why they're still there? Because I took the time to do them right. In a corporate setting where the dentist is seeing 50 patients a day, they don't have that time. They're good dentists trying to do good work in a bad system. I understand why corporate dentistry exists. It's convenient. They're open late. They're open weekends. They take most insurance. They can get you in quickly. And for some people, that convenience is worth it. I get that. But if you're someone who values seeing the same dentist every time you go, having time for questions, getting conservative treatment recommendations, knowing your dentist owns the practice and cares about their reputation. Having dental work that's done right the first time, not done fast. Then corporate dentistry probably isn't your best option. Here's my philosophy, and it's pretty simple. I want to catch problems early. I want to prevent problems when possible. And I want to educate you so you can make informed decisions, and I want to do the work right the first time, so you're not back in 5 years fixing the same tooth. That's not revolutionary. That's just dentistry, the way it should be practiced. But it's hard to do that in a system where you're an employee number 47 seeing patient number 32 on a day with 4 more waiting and a regional manager looking at your production numbers, wondering why you're not upselling more crowns. I'm not anti-corporate to be difficult. I'm anti-corporate because the incentives are wrong. The system rewards volume over outcomes, and you, as the patient, are the one who pays the price. If you're currently going to a corporate dental office and you're happy with your care, great, keep going, seriously. But if you've ever felt rushed or overtreated, or like you're just a number in a system, or you can never see the same dentist twice, or your treatment plan seems really aggressive for problems you can't even feel, maybe it's time to try a different model. A practice where the dentist actually owns the business, where you see the same person every time, where there's no corporate pressure to hit numbers, where the dentist cares because it's their name on the door and their reputation in the community. That's what we offer at the Maryland Center for Complete Dentistry. I'm not employed by a corporation. I'm not hitting quotas. I'm not seeing 50 patients a day. I'm just a dentist who wants to do good work and help people to keep their teeth healthy for a lifetime. After 30 years of doing this, I can tell you this, the model works. For me, and more importantly for my patients. I'm Dr. Jonathan Silverman. If this resonated with you and you're in the Owings Mills, Reisterstown, or Northwest Baltimore area, we'd love to meet you. Give us a call. If you found this helpful, subscribe for more honest conversations about dentistry. Thanks for watching.